This is the anterior rough part, posterior smooth part. This is the vasa vasorum. Okay, sinus vasorum. This is this area, and this is the musculopectinity, which develops from this embryologically this part, this rough part, or where we can see the musculopectinity. Actually, it develops from the atrium proper. Okay, and this part, the smooth part, sinus venorum, which develops from the right horn of the sinus venosus. Remember, the left horn of the sinus venosus actually obliterates. Okay, only a part, that is the left venous valve, is incorporated in the septum secundum. Gradually you will know. Okay. So this is the fossa ovalis, and this is the limbus fossa ovalis. This limbus fossa ovalis actually is this is the interior of the right atrium. Okay, so interior of the right atrium has got anterior rough part, posterior smooth part, and this is the area. It is looking on the right side of the interatrial septum. So three parts: rough part, smooth part, then part facing on the right side of the right side of the interatrial septum. So here in the right side of the interatrial septum, we are getting the limbus fossa ovalis and fossa ovalis, and there is a connection that we can find a opening here sometimes, which is called foramen ovale. This limbus is developing from the septum secundum, and this develops from the septum primum. There are two septum. This is septum secundum. This is septum primum. Okay, so this is the limbus fossa ovalis, and this is the fossa. This forms the fossa ovalis. Okay, when we look from the right side, this forms the depression like. Okay, this is the fossa ovalis. This is from the septum primum, and this is from the septum secundum, limbus fossa ovalis. Your Subramaya sir will tell you in detail during the development of the cardiovascular system. Okay. And what is sulcus terminalis? From superior vena cava to inferior vena cava, we can get a groove that is called sulcus terminalis, and inside we will get and reach that is called crista terminalis. Okay. The same thing we can see. This is inside, we can get a groove. This is called crista terminali, and from outside that the groove is called the sulcus terminali. Okay. The musculopectinity, sinus venorum means the smooth part. Okay, where we can see the opening of the superior and inferior vena cava, and also opening of the coronary sinus. Okay, the Thebesian valve and some other, and sometimes this is the foramina venarum minimarum. There are several openings we can find within the atrium. Okay, those are the opening of some cardiac veins. Okay. So foramina means foramen, venarum means veins, minimarum small. So foramina, venarum, minimarum. The same thing. Okay, crista terminalis, musculopectinity, and everything. And this is that triangle of Cox. We know this is by the anteriorly by the base of the atrioventricular opening, and posterior by the coronary sulcus, above by the subendocardial ridge, which forms the triangle of Cox, where we can get the AV node. Okay, interatrial septum. Same thing. Now in the ventricle we can see there are two parts. One is smooth part, one is rough part. Okay. and within the smooth, and there is a demarcation point which is called the supraventricular crest, okay, which separates the smooth part and the rough part. And within the rough part, we get some features which are called the trabeculae carni, which means some ridges, bridges, and pillars. Pillars are means the papillary muscle. One is anterior pillar or the anterior papillary muscle, which is coming from the sternocostal surface. One is posterior pillar, and one is the septal pillar. From there, from the apex of this pillar, we can get the emergence of chordae tendineae, which are attached to the corresponding from, like, and this is the anterior papillary muscle. Okay, okay. From here, the chordae tendineae are going to the anterior cusp and the posterior cusp. Similarly, from the posterior, it is coming and it is attached to the posterior and septal cusp. From the septal papillary muscle, the chordaes are going to the septal and anterior cusp. Okay, and many a times this posterior papillary muscle is absent. So there are three cusps accordingly. Okay, so it is called tricuspid valve. Okay. So same for the right, this is the right ventricle, inside of the right ventricle. Okay. Now we can see the viscera. Okay. Viscera again, come and see the viscera. Is an organ, it is a prime organ of the cardiovascular system, where we can see the blood from the periphery enters into the right side of the heart. That means on the it is drained in the right atrium, then right ventricle. From there, it is ejected by the pulmonary artery. Okay, so two respective lungs through the right and left pulmonary arteries, it reaches the lung where purification occurs. From there, through pulmonary vein, it enters into the left heart of the, that means it reaches the left atrium, then it reaches the left ventricle and ejected through the aorta, and it ultimately reaches the periphery. Now heart has got, it is situated within the middle mediastinum, and it is enclosed in a double jacket layer of pericardium, that is outer fibrous pericardium and inner serous pericardium. That's serous pericardium has two layers. One is intimately attached, that is the visceral layer, and another is parietal layer. And there are two sinuses which are related. One is transverse sinus, one is oblique pericardial sinus. We know that we have already shown you the several pictures, which one is the oblique and which one is transverse sinus. Now heart has got several, already you have got some idea. It has got apex which is directed downwards, outwards and to the left, and it has got base, and it is conical in shape. Heart is basically conical in shape, which has got apex, which we can see, this is the apex, and the base is nothing but the posterior surface, which is being contributed by both the atrium, majorly by the left atrium and partly by the right atrium. Okay. So we know there are some borders of the heart, okay, and we know other parameters, that is the weight of the heart, we know that is a 300 grams, we know the maximum length, that is from the apex to base, it is around 12 centimeters, and the maximum breadth is around 8 centimeters. And it has got so many surfaces. So heart has got apex, base, surfaces and borders. And the apex, already we know it remains at the level of 5th intercostal space, 9 centimeter away from the midline. Base is nothing but the posterior surface. So apex is directed downwards, forwards and to the left, and the base is directed just reverse to the apex. That means upwards, backwards and to the right. And there are 4 surfaces. The surface which is visible, that is the sternocostal surface. The surface which is directed backwards, that is the base or the posterior surface. One is diaphragmatic surface on which the heart is resting, or inferior surface. One is right surface and another is left surface. And accordingly, we know there are some borders, that is the anterior, that is right border, left border, superior border and inferior border. So this is nothing but the base of the heart. This shows the base of the heart, and also you can see the coronary sulcus. Coronary sulcus, where we can see a vein which is called coronary sinus. Okay, this is the major drainage of the heart. Okay, actually, and the tributaries of this coronary sinus are great cardiac vein, small cardiac vein and middle cardiac vein. Okay, and posterior, and we also this area is also called the posterior part of the coronary sulcus, where we can see the anastomosis between the right and left coronary arteries. Actually, heart is being supplied by 2 arteries, that is the right and left coronary arteries, and this anastomosis takes place within this coronary sinus. And we also know what is the crus of the heart. This is the junction between the coronary sulcus and the interatrial and interventricular sulcus. So this is the crus of the heart, and a little bit on the left we get the anastomosis between the right coronary artery and the left coronary artery. And this one which we can see is nothing but the coronary sinus, it is vein, and within that sulcus we also get the anastomosis between the right and left coronary arteries. Okay, and this vein will definitely drain into the right atrium through an opening within the right atrium, which we have seen yesterday. That is the opening for the coronary sinus, which is been guarded by a Thebesian valve. Okay, that rudimentary valve which is called Thebesian valve. Okay. And we also have some ideas, some apex, apical impulse and apex beat. We have already discussed it yesterday. And apex is, we have seen what is the clinical apex. Okay, that is on the, it is contributed by the left ventricle, situated, where it is situated? It is situated just medial to the mid-clavicular line at the 5th intercostal space. Okay, or it is situated in the 5th intercostal space 9 centimeter away from the midline. So in either of the 2 ways you can explain the situation of the apex. And apex beat, the maximum outward thrust which is been appreciated by with the clinician's palm. Okay, it is seen in the clinics. So this is the posterior surface or the base of the heart, which has been contributed by majorly by the left atrium and minorly by the right atrium. And here we can see in the left atrium, we can see the 4 pulmonary veins, and in the right atrium we can see the superior vena cava and inferior vena cava drains. And superior vena cava and inferior vena cava, they actually drains the blood either from the superior part of the body and from the inferior part of the body. Okay, and we know this is the base, and base is related with the structures of the posterior mediastinum, that is with the esophagus, that is with the thoracic duct, also with the azygous vein, and also with the descending thoracic aorta, okay, and also by the principal bronchi. And it is majorly 2/3 by the left atrium and 1/3 by the right atrium. And it lies over the what is the vertebral level? In erect posture, it is from 6th to 9th thoracic vertebrae. And in lying position, it is 5 to 8 thoracic vertebrae. And clinical base, we also have some idea, that is on the right and left intercostal space, where we can get actually we put our stethoscope over this area for aortic and pulmonary components of the second heart sound. Because second heart sound, we hear the aortic component is heard nicely on the right part of the second intercostal space, and on the left part of the intercostal space, that is the pulmonary area, we can hear the pulmonary component of the second heart sound. There are several clinical aspects like splitting of the second sound. That's not my cup of tea. It is your physiology teachers will explain what is splitting, what is fixed splitting, reverse splitting, and other things. Okay. And in medicine also, you will have some idea during your clinic. Okay. So the surfaces we can see, that is the sternocostal surface, which has been contributed by the right atrium, right ventricle, and the left ventricle, and also by the right auricle, and this is the right the tongue-shaped area. This is also a tongue-shaped area. This is on the right side from the right atrium, that is right auricle. It is from the left atrium, so left auricle. So as a whole, this is the sternocostal surface. Okay. So a part of the sternocostal surface already, and comes in direct contact with the sternum, and and that's why we can appreciate the dull sound on percussion. That is the area of superficial cardiac dullness. Now we can see the inferior surface. This is the inferior surface or the diaphragmatic surface, which lies on the diaphragm. Okay, and it is majorly contributed 2/3 by the left ventricle and 1/3 by the right ventricle. Okay, and there we can see a groove here. We can see this is the posterior part of the interventricular groove, where we can see there is a branch from the right coronary artery. It enters, which is called the posterior interventricular branch of the right coronary artery. This is the left coronary artery, we can see. So this is the anastomosis between the right and left coronary arteries. Okay, there are several branches where the anastomosis is there, and here we can see this is the left. Here what we can see? We can see this posterior interventricular branch is coming from the right coronary artery. Sometimes it can come from the left coronary artery. Okay, so when it comes from the right coronary artery, it is called the right predominance. When it comes from the left coronary artery, it is called left cardiac dominance. And it is very important, okay, because this artery supplies a major part of the interventricular septum. There are several ischemic heart disease where ischemia means there is compromised blood supply to the heart. So it may affect the anterior wall, it may affect the posterior inferior wall and septal wall. So if this artery is affected, then the septal wall of that means the ventricular septum will be affected, because it supplies major part of the interventricular septum. So this is right and left cardiac dominance. Okay. Then left surface, we can see this is the left surface, which is contributed by the left ventricle and also by the auricle. Okay, and here we can find on the left surface there is a groove, okay, in between the left auricle and this and the left border of the heart, which actually lodges the circumflex left circumflex artery of the left coronary artery, the circumflex branch of the left coronary artery, and this is the anterior interventricular groove where we can get another branch which is called the anterior interventricular branch of the left coronary artery. This left coronary artery and right coronary artery, they actually originates from the ascending aorta. Okay, this is the ascending aorta. From there, the left and right coronary artery actually originates. Okay, and the left one divides into major branch, that is the left circumflex branch, which surrounds the left border and goes to the back. It goes to the posterior part of the coronary sulcus, and there is anastomosis with the right one. So already we have come across with the area of the superficial cardiac dullness, the part of the heart which is in direct contact with the chest wall. Here we can get the dull sound because due to the fact there is a cardiac notch of this is the cardiac notch of the left lung. Okay, so the right lung, you can see this is the projection of the right anterior border of the right lung. This is the anterior border of the left lung. That there is a deviation which is called the cardiac notch, and that's why a part of the heart is in direct contact with the chest wall, where we can find a dull sound, which is called the area of superficial cardiac dullness. Then again, there are some borders: right border, left border, inferior border, superior border. So these are the borders. We can see this is the border, okay, superior border, and this is, we can find this is the area which is the oblique sinus, okay, and transverse sinus is in between these pulmonary veins and superior vena cava behind, and in front we will get this aorta and the pulmonary trunk. So we can insert our fingers at that place, that is the transverse pericardial sinus, and this area is the area which is called the oblique pericardial sinus. And intimately attached, there is the pericardium, that is the serous layer. Serous layer. If you remove the pericardium, the fibrous pericardium, then we will get the serous pericardium. Okay. And intimately attached, that is the visceral layer, and one layer is reflected outside, that is the parietal layer of the serous pericardium. So these are the borders. Then right border from the this is the line joining the superior and inferior vena cava. Okay. Similarly, left border we can find, and this border separates the sternocostal surface from the right surface. Similarly, the left border we can get, okay, it is a bit convex, okay, and it starts from the auricle and ends in the apex. Okay, it separates the sternocostal surface from the left surface. So inferior border, this is the inferior border. Okay, here we can find a marginal branch from the right coronary artery. You can, and also in the inferior border, you can, at the end we can get the apex, and just medial to the apex we can get the groove of the anterior interventricular sulcus, and here we can get a notch which is called one cardiac notch, incisura cardia. Okay, this is called incisura cardia. So inferior border starts from inferior vena cava to the apex. Upper border, it separates the heart from the great vessels. We can see this is the great vessels. On the right side, this is the pulmonary trunk, and from the left side, it is coming out, but it is going to the right side. So aortic area is on the right side. Okay, and you can see pulmonary trunk is towards the right. I am very sorry. This you can see this aortic area, it is going to the right side. So aortic area is on the right side, and pulmonary area is directed towards the left. So it is directed towards the left side. So it is found on the which space? Second space on the aortic area is on the right side and pulmonary area is on the left side. Just if you can remember this figure, there will be no confusion, because you might think that aortic area, it is from the aorta from the left side, so it should be on the left side. No, because aorta actually first moves to the right side, then it goes straight, then forms an arch of aorta, then descends. So already we have come across this group, atrioventricular groove, and that is the coronary sulcus, okay, which has got C-shaped, and in the in front it is incomplete because of the fact the great vessels are coming out. It has got, this is the right part of the atrioventricular sulcus, this is the left part of the atrioventricular sulcus, and this is the posterior part of the atrioventricular sulcus. So this is, as a whole, it is called the coronary sulcus. Coronary sulcus starts from here, is rounds the back, again it ends it here. So, and in front it is been interrupted by the emergence of this blood, the great vessels. So it is C-shaped. And this is the interior of the right atrium, where we can find the opening of the superior vena cava, inferior vena cava, and also this is the opening of the coronary sinus,